Chronic fatigue syndrome is a condition where there are specific clinical criteria that need to be met in order to be so diagnosed. Once diagnosed, then the patient is usually put on a battery of compounds, including muscle relaxants, as well as items to help deal with the fatigue, such as stimulants. This is Dr. Lam, founder of drlam.com. Now, when this type of situation continues and the sufferer has been struggling with chronic fatigue for some time, they either improve, they can just stay put and plateau out, or they actually get worse and not improve. Now, obviously, if the situation improves, then they are happy. If the person does not improve, then the question is why? Now, in the case of chronic fatigue versus adrenal fatigue, there are a lot of similarities, but there are also a lot of differences. I won't go into all the differences here, but it suffices to say that they have their own set of parameters to watch out for. And if a person is being treated for a chronic fatigue, but fail to improve, then you have to think of adrenal fatigue as a possible reason. There are things to look out for in adrenal fatigue that's very different, such as the history. In chronic fatigue, usually the history is not as much stress-induced, but it is more so in adrenal fatigue. In chronic fatigue, you have less sympathetic type of symptoms, but that is quite prominent in advanced stages of adrenal fatigue. So a detailed history would be able to tell the story, and that's usually the only way, because laboratory tests are not sophisticated enough nor sensitive enough to specifically tell you about chronic fatigue nor adrenal fatigue. Both are highly dependent upon the clinician's clinical skills, experience, as well as their understanding of what the body is going through physiologically. So if you have been told that you have chronic fatigue and you, despite conventional medical help is not improving, you have to think whether you do have indeed the symptoms of adrenal fatigue and not chronic fatigue. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.